All right. Hi, everyone. I'm Tom Quigley, and we have Anthony McMahon and Tina Hatfield with us. We are going to go over a slide deck. So when you view this, if you're not live, you will be able to hopefully get a feel for what we're doing on health insurance benefits that lower your costs and improve your benefits for your employees. Sometimes using the same insurance carrier. Once in a great while, if the agents cooperate, you can even keep your same agent, but don't bet on that. So go ahead, Anthony, start the deck if you would.
Yeah, so
So
first Tom's going to go over what is a medical expense reimbursement plan, which is really the main pillar of our solution.
what a medical expense reimbursement plan is a 1954 tax law that rides under Section 105B of the Internal Revenue Code, and they refer to Section 213D expenses that refer to, believe it or not, the IRS refers it to a publication they put out, 502, and you literally can look up what expenses that you can provide your employees, tax-free business expense, tax-free to the employees. And if people understood that, they would buy their insurance a lot differently. Okay.
Awesome. And then we can get into now, if you want, how we use primary insurance and, really what owners should be doing on that side of it and what's important there.
So if you look at your current primary insurance plans, and you look at what the maximum out of pocket is, and you go to the cheapest plan that's available with the same insurance carrier and get a calculator out, it doesn't have to be an algebra word problem. It can be actually basic math. You can quickly realize that almost every one of you is giving the insurance company more money than the actual risk. Or if you're self-funded, you're taking on too much risk because of the HIPAA and the Affordable Care Act. There's ways to mitigate risk that saves you hundreds of thousands of dollars in claim avoidance.
For sure. And you can see right here, as an owner, all you should really care about is stop loss coverage. And then all your employees are going to care about is that network of hospitals and doctors. Just piggybacking off of what Tom said, you're typically paying much more in premium than you're ultimately risking from going to a higher deductible plan. Here's an example. This is in my state of Pennsylvania. Here's a gold plan, which most business owners would have their company signed up with. Most agents and brokers would advocate for. Here's a bronze plan on primary, and this is what we would advocate for the business to purchase as step one of a two-step solution. And it's really, like Tom said, just a math problem. If you compare deductible, 2,000 in the gold, 9,100 on the bronze. So at most, it's a $7,100 difference, not accounting for co-insurance, which would lower this a bit. But if you go into how much the policies cost, the monthly premium on the gold is 2,300 bucks. Annual premium is 27,500. If you bought the bronze instead, it's only going to be $1,200 a month or 14,500 throughout the year. So if you compare it, they're both Anthem Blue Cross Blue Shield of Pennsylvania. They're both HMOs. They both have the same exact provider and hospital network. Yes, if you buy the bronze instead of the gold, you're potentially taking on more risk of $7,100, but you're saving over $13,000 in premium. So it's a no-brainer every single time. The only problem is you don't want to give your employees a $9,000 deductible, and that's where the MERP comes into play. So we can go ahead and walk through that further if you want, Tom, especially the part about, giving your employees better benefits on their primary. If we want to touch on that real quick, and then I can show an
Sure.
example.
Yep.
Yeah,
So, with that said, what we're doing is improving benefits for the employees. If your savings is greater than the risk and you're paying X amount, why would you ever, if you're guaranteed to save, why not give the employees lower out of pockets, lower copays, lower drug copays? And you can literally set that up through the medical expense reimbursement plan, just like the insurance companies do. But you do it, it's your money, it's your savings, and you get to keep whatever is not used. And even if it is used, you still get to keep some of it because you're saving more money than the actual risk.
Yeah. And here's an
So,
example of what that would look like, that Tom's alluding to. Clients do all different things. You could either copy your same schedule of benefits. So if you had a 2,000 single deductible, 4,000 for a family, and then these various copays right here, you could essentially just copy and paste that into a Merc. That would act as the day-to-day benefits for the employees, or like Tom's saying, most of the time you're saving so much that it really doesn't make sense to not improve the employee benefits, lower their copays, lower their deductibles. So, you might be able to take somebody from the, 3,000 deductible that you have right now down to a two because you're saving so much in premium for primary. And then the last thing I'll show here before we get into the cards and then ultimately, what it looks like in terms of savings is the back end financing of it. If you want to touch on how it's set up differently and how we manage it as a TPA zone.
so all we're doing as a third party administration company is piggybacking off of what the major medical carrier allows and covering the difference that uh, is between their new deductible and their old. And what we do is we give everyone a second card and we manage it. The employer pays us and we pay the doctors, hospitals directly. We team up with the pharmaceutical carrier on our card. So at point of service at the pharmacy, they're still paying their copays and getting their drugs. And in fact, if they're on brand, they generally get to pay a lot of times nothing because of the rebates and the grants that are available and the coupons. And we take advantage of it all. And for the employee, all they're doing is going to the pharmacy, handing them the card, and they come back and they tell them $5, 0, 10, whatever it is. And they pay a lot less than they did before.
Yep. It's really as simple as that. And, it would be the same exact, scenario for the employees as they have right now. Say that they had a $2,000 deductible before through the MERT, they still have that, meaning that they'd be on the hook for the first $2,000 of claims. The only difference is now you as the employer, you're taking, some of the savings and premiums that you're getting right here, and then you're paying that potentially if the employees use it in this employer funded gap over and above the employee's obligations. But as Tom mentioned, you're saving more in premium than you're ultimately risking. So even if this employee in the scenario, has, surgery that costs $100,000, you're still saving money on this employee, and they're saving money as well through cheaper premiums with the same network in place. It's just financed differently in the back end, but we manage all of that. And last thing, as Tom alluded to, the only difference from the employee's perspective is they have two cards. They'll have their primary card with whatever major carrier that they're signed up with, and then they'll have their secondary card that outlines the schedule of deductibles, copays, et cetera, that are through the MERP. So at the point of service, the front desk knows how much they're actually obligated to pay, whether it's a copay or whether it's a deductible coverage. And then last thing we'll show you here is just a quick savings scenario. So we're based in Cincinnati, Ohio. This is one of our groups. You can see that they paid over $1.7 million the year before signing up with the solution that we just walked you through. The very next year, they only paid $826. They almost saved $1 million. They saved $937,000 total. They went from paying $16,800 per member all the way down to $7,800 per member. Same primary coverage, same benefits underneath. It's just financed differently in the back end and managed by Plain Links as a TPA. So that's really how you do it. I don't know if you want
If
to
you think about that, $937,000, say their EBITDA factors 5, they increase the value of their company by 4.7 million. Think that through. How many sales is that? If the profit margin is 10%, that's a $47 million sale. That's what you have to look at. Tina's, you just had a new case, 3 people. They're going from like 7,200 a month down to 2,800, and they save $4,000 or $5,000 a month. So they save 4, and let's say their EBITDA factor is 5 again. Every month they're increasing their value by $20,000.
He's very happy. He's excited.
Yeah. This is just math. It's just math, guys. It's basic business when you're sitting in and the teacher draws a T and says assets, liabilities. It's shifting the asset to the liability to the asset column. And, for an established business, that's sometimes the difference from having a profit or a loss that year. And it's sometimes more valuable than new sales. It's just crazy what people are doing. It seems the larger the company, the more ripped off they are because they're not willing to look at things differently. They think they're too big to do anything different. They don't realize, I could come in and most of them, um, they're paying $250,000 to some insurance agency to tell them to call 1-800 and talk to somebody in Taiwan or India. I don't want to, discriminate against any of these countries or the Philippines. You got people who hardly know English they've outsourced because they pay them $3 an hour versus minimum wage 15 now. So that's the issue. And people literally fall for this year after year. And what we're saying is when you're ready to quit overpaying, and you want to give your employees more, call us. But you have to look in the mirror and you have to say to yourself, what's the definition of insanity? Doing the same things over and over again, thinking you're going to get a different result. And I didn't say that. I mean, Webster in his great dictionary, go to insanity. It's pretty close to what I just said. It may not be verbatim, but it's close. So that's all we have for today. So I appreciate everyone. Have a wonderful rest of the day here on a Thursday. And I'm in Florida and it's cold here. It's only in the 40s. So there you have it. In
Yeah,
Fort Myers.
appreciate everyone jumping on. Like Tom said, if anyone has questions, feel free to, email us afterwards, schedule a call. We're happy to walk you through it. But really is as simple as this. It's a two-step process. It could save your business money. It could save your employees money. It can improve their benefits, give them less liability and potential medical debt. It's a win-win-win across the board. We work on what we save. We only make money if you save money, and we have our interests fully aligned, with you guys as owners. So I'll stop sharing for now.
All right.
But we'll host more in the future, and definitely reach out if you have any questions.
There you go. Good times.